So I just wanted to do a little follow-up to the video I put out last week about hip flexors and the role that they play and don't play when it comes to somebody getting into or not being able to get into a squat position. And just really follow that up with an introduction into why alignment is the number one thing we should be looking at when it comes to somebody's range of motion and wanting to potentially affect change in their range of motion, if that's something we choose to do or something that they want us to help them with. So as we were talking about hip flexors, then I think we should talk about hip extension, which is this action here. So the opposite to the action that a hip flexor performs. Therefore, again, tight hip flexors are quite often blamed for somebody's lack of hip extension. Hip extension is a really important thing, something that's really important to maintain. An ability to do this here is fundamental to every sporting action, all forms of athletic activity, functional movement, just general health and well-being. It's important that we can do that. Seems simple, but being able to move this bone behind this one is a really important thing. And therein lies the issue, really, because genuine hip extension is a movement of the thigh bone, so this femur right here, relative to the pelvis, it's hip bone, right? So it's that, okay? And if we keep in mind that we always should be measuring movement of one part of a skeleton relative to another part of that same skeleton, rather than a part of this skeleton relative to the floor or mat or table that we've put them on, then we won't go too far wrong. So the hip flexor stretch is a really common thing. You see it at the end of most exercise classes. You see trainers doing it with their clients. You see people working out on their own thinking, I should probably do that. Hip flexors, yeah, I know they get tight, I should do that. And they get themselves into that kind of kneeling position and start driving forward into what they think is a hip flexor stretch. So if we consider, again, just reminding ourselves where a hip flexor runs. So from thoracolumbar fascia, obliquely from posterior to anterior in your body, and attaches right here. So in order to put that under tension, if we want to stretch that, we have to move this bone back relative to this one. So the opposite of what's happening in a squat. So this, so hip extension will put that muscle under tension. Okay. Now the stretch, for want of a better word, action that we see in the gym all the time, that we see performed at the end of classes, that kind of kneeling and driving forwards, what you're seeing there is actually this. So you're seeing femur and hip, so thigh bone and hip bone here, moving together, right? So they're both moving, and the thing that's being lengthened is not the hip flexor, it's the abdominal wall here. So these muscles. So you're seeing that chest, you're seeing that torso stay put, and you're seeing the pelvis and the femur move together, lengthening the muscles that we don't want to lengthen, compressing these structures in the back of the spine that we don't want to compress. And if anything, what's happening to that hip is it's staying in the same place, relatively speaking, but we're just pushing forward on those structures from the inside. Right, if we want to put a hip flexor under tension, what we need to do with the pelvis is this. Okay, so if we want to stretch a hip flexor, if we've appropriately assessed this person and decided that's something that we want to do, what we do is we put them into with a vertical femur. That can be it can be in that kneeling position if we want, right? And what we do is we get them to do that, right? So what we get them to activate the muscles that rotate a pelvis this way. So they are glutes, hamstrings, abs. So core and glutes, right, that do this, that pull down at the back and lift at the front. And if this stays where it is, what we've done is we've produced relative hip extension, right? So we've genuinely stretched that muscle, right? By doing this, it may look more effective. It might look like there's a huge amount of range of motion occurring, right? There is, but where is that range of motion occurring from? And that's the question we need to always ask ourselves, right? If that range of motion is occurring because this is happening, we're not addressing what we think we're addressing. We're doing something. If somebody's moving, they're always doing something, right? But what's happening in that is lengthening the abdominal wall, never a good idea. Compressing the lower back, again, never a good idea. Not really doing anything to that hip flexor. Okay, so think always alignment and relative movement if we want to affect change. So get somebody as neutral as possible and then work from there. So get this person neutral, anchor that where it is, and get them to work into a posterior tilt. So they're kind of tucking their bum underneath them. That is how you put the tight hip flexor under tension.